Dr. Scott Blickensderfer, and I'm a staff urologist here at Memorial Hospital. And in conjunction with a new nursing policy and procedure, this video conference is designed to instruct the RN in the appropriate insertion techniques for a Coude catheter. We're going to discuss briefly the indications for catheterization, and we're going to also discuss the difference between a Foley catheter and a Coude catheter, as well as the appropriate insertion technique. When completed, this video conference should allow the RN to appropriately describe the insertion technique of a Coude catheter as well as the indications for its use. Foley catheterization is indicated for those patients who are in acute urinary retention. We also use a catheter in order to establish post-void residual volumes in those people who do not empty completely, as well as to maintain accurate input and output information, and in the occasional patient who has immobility that does not allow for bathroom privileges. Urinary incontinence is rarely an indication for catheterization. On the other hand, if skin breakdown issues are present, catheters will sometimes protect for the development of decubitus ulcers. Foley catheters have been used for approximately 60 years in this country. It's a standard nursing protocol, and the only difference between a Foley catheter and a Coude catheter so far as the insertion technique is the actual design of the Coude catheter itself. In general, the Coude catheter is designed for men with obstructing prostate symptoms and a difficult passage through the prostatic urethra. It can occasionally be used in the female patient when the urethra is retracted behind the pubic bone, particularly those women who are elderly and have atrophic vaginitis. The Coude catheter is somewhat more safe in general than a standard Foley catheter. We're going to take a look briefly at an anatomic depiction of the prostate, urethra, and bladder, and this will help further enhance the visualization of how a Coude catheter is inserted. In the standing position, the male urethra has an S-curve type configuration prior to insertion into the prostate gland and into the bladder. It's at this point that complications with Foley catheter insertion can occur. With the penis straight, a Foley catheter inserted from the tip will be able to manage this area of the urethra. In the level of the bulbar urethra, the urethra takes a significant curve anteriorly towards the umbilicus prior to entering the prostate gland and then into the bladder. Foley catheter trauma generally occurs when there is too much obstruction at the level of the posterior aspect of the prostate. That's that part of the prostate closest to the rectum. The catheter cannot traverse this, and penetration or perforation can occur in the posterior part of the urethra, which then leads to bleeding. The Coude catheter, appropriately inserted, allows to follow the natural curve of the urethra and then to the prostate gland and on into the bladder. Coude catheters come in a variety of sizes, and they also come in a variety of materials. It is possible to obtain latex-free as well as latex Coude catheters. Your average Coude catheter will be a 16, 18, or 20 French catheter, and in general we recommend the larger catheters because they are somewhat more firm and they will traverse that area of irritated prostate or prostatic enlargement to facilitate appropriate passage. When viewed from the side, the Coude catheter demonstrates its natural curve, and when inserted in this manner, this will allow for the curve to follow the natural curve of the penis, prostate, and bladder. At the hub, a small knob is identified where the catheter will be inserted into the Foley bag. This knob indicates the direction of the curve for the prostatic urethral curve of the Coude catheter. In the sterile position and in patient supine, the penis should always be brought to a straight position to allow facilitated passage of any catheter through the pendulous urethra. After a sterile prep and drape, xylocaine jelly can be used or standard lubricating jelly. Currently at this hospital, lubricating jelly is supplied in a syringe. This facilitates passage of a catheter if the syringe is brought gently to the meatus of the penis and the jelly is inserted slowly through the entire length. A small amount is left behind to allow for covering the first part of the catheter. This should be performed for any catheterization. The catheter is grasped in a standard manner, and the curve should be noted to be pointing towards the ceiling or the patient's umbilicus. Gentle insertion into the penis allows for passage of the catheter. The lubrication allows for continued passage, making sure at all times that the knob present at the tip of the catheter is pointing towards the ceiling. This tells you that you're in the proper position for continued passage of the catheter. Upon complete passage through the prostate, the curve of the catheter is pointing up towards the umbilicus. Generally, we're supplied with 10 cc's of saline or sterile water for blowing up the catheter's balloon. We recommend inserting all of that. This allows for catheters to remain in place even in the presence of a confused patient who cannot pull the catheter out. The catheter is brought gently back beyond the prostate, or to the level of the prostate, and it's connected to straight drainage. To conclude, insertion of a Coude catheter is done when a standard Foley catheter either cannot or will not pass safely through the male urethra. Generally, an 18 or a 20 French Coude catheter is preferred over the smaller catheters as they are somewhat more firm and less likely to create significant posterior trauma to the urethra. The Coude catheter is inserted in exactly the same manner as a standard Foley catheter, care being taken to allow the natural curve of the catheter to proceed in an anterior direction towards the ceiling or the patient's umbilicus. Thank you for your attention.